Well, the fact of the matter is the new strain is here. A lot of new questions tonight about it. Let's get some answers with Dr. Peter Chin Hung, infectious disease expert at UCSF. Great to have you yet again. Are you surprised at all about the new strain in California, and when would you expect it to be in the Bay Area?
Well, Terry, it's probably already here in the Bay Area. And as Dr. Fauci said, none of us are really surprised. There's been so much travel back and forth between the UK and the US. So discovering it is not really something new. It's probably just the tip of the iceberg.
Well, you know, when we hear it's 7 times more contagious, that sounds ominous, this new strain. Sounds like we're going to have many more cases in the next few weeks or longer if it's that much more infectious. Would that be correct?
Well, many people think that it's maybe the driver of the surge in Southern California. So it may not be anything new that we're going to experience. I'm more worried about the surge on the surge on the surge that will happen after New Year's Eve festivities, regardless of the variant. But it is something that I completely respect.
Well, what more should people do because of this new strain, or what should we just do? What should we do right now going forward?
Well, I think that people should definitely wear their masks, practice their social distance, be outdoors as much as possible if you have to meet someone for New Year's Eve. And, you know, we really can't take another surge. Our hospitals are bursting at the seams. So if it means that it's a more transmissible variant and it makes you sort of remember where we are right now, I'm all for that. And I promise that next New Year's Eve will be back to normal.
All right, we'll take a promise from the doctor. I'll take that. Let me ask you this, though. Is this going to prolong the lockdown, this new strain? Are we going to set up a few more weeks? Could it be past that?
Well, the one thing I'm worried about, Terry, is that you're right. Right now, the UK can't get a hold of this strain, meaning that they've had lockdown, and yet their cases continue to rise. They're increasing restrictions geographically across the swath of the UK. So they're desperately trying to get a hold of this virus. It's not acting like the previous lockdowns. So that's why I'm worried that this will prolong, you know, where we are right now.
One thing I don't understand is a virus seems to know, I'm just using that word because it seems to fit, it seems to know that it has to evolve in order to survive. We had the coronavirus, and now it has evolved into a new strain so that it can continue on. How does that work exactly?
It just works by chance, Terry. So it's said that every 2 weeks we have a new variant of COVID. And it's because these kinds of viruses, they're RNA viruses, they're very imprecise, so that you probably won't hire a COVID to be in your workforce because it'll make a lot of errors. And because it's imprecise, when it makes a copy of itself, it's not exactly the same all the time. Most of the times, nothing happens. It turns out that this particular variant makes a mutation in the spike protein, and this is what the cell or the virus uses to enter the cell. It makes it sticky, so it's like it's going onto the surface of your nose or mouth, and it's like Velcro, and it's just sticking there. And the more it sticks there, the higher the chance is that it will get into your body.
That's a great explanation, and that's a nice visual you had there as well. One of our great hope right now is the vaccine, but the rollout of the vaccines, some were saying 20 million Americans vaccinated by the end of this year. We're running out of days now, but we're going to have less than 10% of that. What needs to be done to get things moving? Do you have any thoughts on that?
Yes, totally, Terry. I can talk to you about this for hours. It's been something that I've been losing sleep about, frankly. The fact is, not enough money was allocated by the federal government for distribution. A lot of money was spent on getting the vaccine and the science, but the states had asked for $8 billion because it takes a lot of logistics to distribute a cold chain vaccine, and they only got $340 million. So I think we're paying the price for that now. I think that with the new administration, they are pledging to try and beef up the distribution. But if we couldn't distribute something simple like a 10-cent mask, it will be hard to think that you can overturn a system overnight. to make a smooth and clean distribution of vaccines.
All right. Dr. Peter Tin Hong, thank you again for taking the time to be with us this evening. Thanks a lot.
Thanks so much, Terry.